I would like to say that the heart and the core of the initiative is the interest of patients and parents of those patients who had encountered the disease. So this is how we're going to start the day, and I'll hand the microphone to Nadine to introduce the first speakers.
Thank you, Najib. Thank you, everybody, for joining. So our first session is called Ignite the Talk. It's a parent-patient advocacy session to show perspectives to work, perspective towards a working entity. Our moderators are Dr. Fahad Al-Ahmadi, who's an assistant professor of pediatric cardiology at Taliban University in Medina in Saudi Arabia, and Dr. Antoine Abdelmasih, who's an associate professor of pediatric cardiology at Sheikh Khalifa Medical City in Abu Dhabi. They will take over and introduce their families.
I'm honored to be here with you today. Very thankful for our courageous families that are here with us, accepting to be with us. I would present Adriana, our first speaker. Could you please start?
Yes. So, hello, everybody. First, thank you very much for having me on this panel. My name is Adriana, and I'm a fourth-year student at the University of Toronto, currently living in Toronto, and I'm double majoring in physiology and human bio, and I was once a Kawasaki disease patient. So, for nearly every year of my life, until I was perhaps 17, I had yearly echocardiogram checkups with my cardiologist, and to this day, continue to take my lifelong prescribed aspirin every single evening. And when I was really young, I didn't think much of my yearly checkups or my aspirin. I think it became a sort of standard part of my life. And I think I assumed everybody was living the same way. And of course, they weren't. And I think the point at which I became more aware of my life as a patient was when I was around 11 and I was beginning my first period. My mom called my doctor to see if the aspirin prescription should be changed, if I needed to conduct any other tests now, or if I would have some sort of like anomalous experience with my periods. So I became curious about what my childhood illness would mean for my health moving forward and started doing my own personal research through reading and by asking my cardiologist more and more questions with each checkup. I started sneaking peeks at my own echocardiograms, and she began showing me around my own heart. And that was a really fascinating experience for me that kind of drove me forward towards an interest in medicine and health advocacy specifically. And through my research and listening to my mom's stories about the difficulty of my diagnosis, I was conscious of the fact that Kawasaki disease is rather under-researched and awareness of it is quite low. I understood it to be a sort of autoimmune disease that increases risk of acquired heart disease and that it's treated with immunoglobulin and aspirin, but I couldn't find info on its cause or its specific pathobiology. I actually don't think I would have heard of Kawasaki disease if I wasn't a patient myself, and none of my friends who I spoke to about my disease had ever heard of it either. So I was then really interested in searching for opportunities to help spread awareness for it. And through random Googling one day, I discovered the Kawasaki Disease Foundation based in the United States. I filled out their contact form indicating my interest in volunteering however possible, and they linked me to a new initiative that they were starting right at the point that I filled out their form, KDF Youth, which was aimed at involving young patients in online campaigns to spread awareness of the disease. And I met 4 other amazing young girls near my age who either had a personal experience with Kawasaki disease or had a sibling with KD. We were working together to kickstart KDF Youth and launch different initiatives to maximize awareness. And their Instagram is at KDF Youth, and you should all check it out. And I was responsible for the Twitter account and the KD Fact series, for which I researched and gave bite-sized facts about the disease for people to learn from. We reached out to patients and their families to share their stories and ran Instagram lives to host doctors and researchers who wanted to speak about the disease. It was a really rewarding experience for me to have been part of such an initiative and to have actively involved myself in learning more about the disease and contributing to improved family awareness. We all know early diagnoses are critical to better patient outcomes, but they're difficult to achieve without proper awareness of various diseases. Kawasaki disease is one such disease for which early treatment is critical. And I am personally incredibly grateful for the speedy efforts of my own physicians, which my mom will speak more on, to diagnose me and get me the treatment I needed. More research is definitely needed on the matter as the cause remains unknown, and research has been mainly focused on treatment outcomes and patient demographics from what I have been seeing. And from what I've learned in my own studies in undergrad, rare diseases don't often get much traction in research funding, but I believe it would make all the difference in the world for many families around the world to discover more about the causes and progression of the disease in order to be able to tackle it early and empower families with the knowledge to protect their children. So my positive experience with my own doctors and my passion for patient advocacy have both actually motivated my own interest in medicine. And moving forward in my life, I'm continually interested in learning more about Kawasaki disease and contributing to research and awareness efforts to improve patient care and promote early diagnosis. Thank you very much.
Thank you very much. Now I'm going to ask Ms. Guri, the mother of Adriana, to talk to us.
Good morning. Hello. Thank you for inviting me to this panel. My name is Carla, and I'm a full-time mother of 3. Our firstborn, Adriana, who's here with us today, was diagnosed with Kawasaki disease when she was only 9 months old. What started out as a simple gastroenteritis turned out to be something much more serious than that. She was admitted to hospital for severe dehydration, and she received IV antibiotics, but her blood results were very alarming. Her CRP was very high. Her red blood cells were low. She was anemic with a very high count of white blood cells. She stayed in hospital for a week. And at that time, she was very irritable. We were sent home because she was hydrated and continued her treatment with antibiotics orally at home. 2 weeks later, her blood tests still weren't good. So her doctor asked for a panel of physicians and mentioned his fears of Kawasaki disease. The doctor said that it's probably not. She didn't have the symptoms. And they concluded it was probably a leukemia because of her white blood cells. So at the end of week 2, we started a new series of blood tests. She had a heart ultrasound, which showed no abnormalities, but the insurance refused to pay for the biopsy because they said that the blood tests weren't conclusive of leukemia. So we were sent home again on week 2. By the end of week 3, Dr. Radi, who's our hero, he called us for a meeting and mentioned his suspicions about Adriana having Kawasaki disease. At first, we thought he was joking because we've heard of the Kawasaki bikes. We never heard of Kawasaki disease, but he wasn't. And he asked us to have another heart ultrasound at the end of week 4, which we did. And it confirmed his fears, as Adriana had several aneurysms in both her coronary arteries, which reached 8 millimeters in some areas. So we were rushed to Hôtel Dieu de France, where she received several shots of immunoglobulin over a period of 48 hours. By then, her blood results were good. And only then her physician, cardiologist, Dr. Linda Dow, said that there is no vital risk on her, thankfully. And during those 2 weeks, she stayed 2 weeks in hospital. During those 2 weeks, Adriana was having daily electrocardiograms, ultrasound every other day. And till we finished the 6 weeks of the disease, because they say that it's the critical period of the disease was 6 weeks. So when she finished her 6th week, she was sent home, and her the heart was intact, the muscle was intact, thankfully. So for 15 months, she was having monthly checkups, electrocardiograms, ultrasounds, and blood tests to check the thickness of her blood. She was put on aspirin and on Centron. I think you have another name for the blood thinner. And then 15 months later, we did her first catheterization, which showed a stenosis between two aneurysms in the right coronary artery. Dr. Zakia Saliba performed the catheter. We had to back the results up with a stress test and the scintigraphy that showed that the activity was normal. But then Dr. Dow sent her file to Necker Hospital in Paris because they thought that in case she needs a stent because of the stenosis, we will have to do it outside of Lebanon at the time. So she sent the file to France, and we sent her file to Melbourne Children's Hospital, and we took an appointment there. But Professor Sidi at Necker, when she turned 17, we did her last catheter, and she was declared as a fully recovered patient.
Excellent, excellent. Thank you very much for both of you. Very grateful for your courageous family to be here with us. Inspiring talk. We are going to switch to Miss Rislan to give us a point about her experience with Kawasaki disease as a parent.
Hi, everyone. My name is Nidar Razlan. Thank you so much for having me on this panel. I'm a Kawasaki mom. My son had Kawasaki disease in 2008 when he was 7 years and 3 months. And now I've joined the Kawasaki Disease Foundation in Australia maybe about 2 years after that happened. And now I'm the parent support coordinator for the Kawasaki Disease Foundation in South Australia. Our story started off with the usual, like temperature. Temperature wouldn't go down for 3-4 days, 5 days. Went to first doctor, said it could be a viral infection, came back home. It developed to tummy pain and a headache. Went to the hospital and they said, that could be, they took a swab. They thought it was a streptococcus, but it was negative. And then I took him back to another doctor, said, keep doing what you're doing. He's okay. It's only a virus. I'm just telling you briefly because I noticed that we don't have much time. So at last, he had a swollen glands and he had a swollen scrotum. And that's when I called an ambulance and went down to the hospital. And I was furious then because I've been twice to the hospital and they sent me back home. So a surgeon came and saw him that day and he said, we have to perform a procedure to see whether his testicles are twisted because it does look really abnormal. And that's what happened the following day. 3 days in the medical ward with antibiotic, intravenous antibiotic. His temperature wouldn't go down. So the surgical team has referred us to the medical team then. And still temperature is spiking up all the time. They did all the blood culture, blood test, bone scan, chest x-rays, all the tests that they can do to eliminate stuff, and they wouldn't know what was going on. By the time that happened, we were on day maybe 14. A senior doctor came and spoke to us. His name was Dr. Pearson. And he said to me, look, Mrs. Razlan, we really don't know what's going on. It's a puzzle, to be honest with you. But I'm considering maybe it could be Kawasaki disease. And I have never, ever heard of it. And he said, we want to do an ultrasound for the heart. And I thought, okay, what's wrong with his heart? I'm sure there's nothing wrong with his heart. They just don't know what they're doing. Like, I was so frustrated. So we went down to the ultrasound room. They did the ultrasound, and a senior cardiologist came and spoke to me. And he said there is some inflammation in the coronary arteries. They look like a bit swollen, a bit like a cigar shape. And just to be safe, we want to give him a medication called immunogamma-globulin. So on day 14, he had his that day he was so irritable. Some other symptoms have come up, like the strawberry tongue and the cracked lip and the red bloodshot eyes as well. And his temperature went down that night, around 2 o'clock, 3 o'clock in the morning. Temperature spiked back up again, and he started peeling, like the hand and the feet start peeling. So they decided to give him another round of immunogamma-globulin, which worked for maybe 24 to 30 hours maximum. They sent us home then. By the time we got home, he got temperature. So we went back down to the hospital, and that's where the immunology team start working on him, the rheumatology team, sorry, the rheumatology team. So we had the medical team, the cardiology team, and the rheumatology team. The three of the teams were working on him, and they decided to give some kind of steroid, which made him miserable as well. He had like puffy cheeks. He was eating 24/7, and he wasn't well at all, and his temperature didn't go down. So to make the story a little bit short, they did another ultrasound for the heart. They found that the right coronary artery has a giant aneurysms in it, one giant aneurysm, which is 9 millimeters, I think it was. And on the left coronary arteries, he had 3 aneurysms, one 5.2, the other one was 3.1, and the descendant one at the end was 2.1, something like that. So, and that's how our journey started with Kawasaki. Then the rheumatologist at the end of it, that was 6 weeks on, decided to give him an adult medication called infliximab, and we had to sign paperwork for it to see that we agreed to it, and she had to ask the medical board to be able to use it, and it had so many side effects. He could have an anaphylactic shock, he could have a heart attack, you name it. So we were really, it was really the hardest time of our life, to be honest with you. And they did give him the infliximab. Of course, they gave him the warfarin and the aspirin, and they were doing blood tests every morning and every night to see his level with the warfarin. He was bruising easily, and it was really, really hard and tough, to be honest with you. When they administered the infliximab, they actually, it shows the time of the day where the whole nursing team is in the ward, and they put us next to the nursing station. They informed the ICU if he had any, side effects, so the ICU is going to be ready for him. And they did give him that medication, and we had to wait. He didn't have any side effects. The following day, they did a blood test at 7 o'clock in the morning, and at around maybe 9:30, the rheumatologist came back with the result. His CRP in the blood before the infliximab was 300. And after the infliximab, it went down to 4. And it was a miracle, to be honest with you, because I don't know how that happened. 6 weeks on, and that miracle doctor and medicine did the trick. And since then, he's been doing stress tests every 6 months. He's been doing, sometimes they do an angiogram as well. He's he wasn't allowed to play any contact sport or anything like that before, but now he's actually playing soccer and for our community team, and he's at the gym and he's doing bodybuilding. But the last angiogram showed that he has blockage to his right coronary artery for about 75%. And the doctors, they did like a team of cardiologists meeting to see whether they can stent it or maybe decide on an open heart. They went against the stenting. They said it's too long. There is no stent that goes, from one side to the other that big. Like different opinions, to be honest. I was recently in Lebanon, and I went and saw 3 cardiologists in Lebanon, and I took his results with me, and I did send the result to Dr. Najib as well. And everybody gave us different opinions. So we still in the unknowing, to be honest. They don't know to decide what to do with him at the moment. But he's doing fine. There is no symptoms. He's going strong, and now he's 23 years old, and he's doing his PhD on quantum physics at uni. So he's really done marvelous.
Nidar, thank you very much.
Thank you.
Yeah.
Thank you.
Yeah, please trust us. The coronary problems in the adults is really what we try to solve slowly, but certainly at the International Kawasaki Disease Society. And Kawarabi is certainly part of this big society. So please bear with us. We continue to take it one case at a time. Every single patient is different from everybody else. It's certainly different from the adult typical coronary artery disease. But we're getting there, and we have solutions.
Yes, I hope so. Thank you so much, Dr. Najib. That gives me hope.
Thank you for the testimonials. This is very precious. Please stay with us. You are welcome to attend the whole day today and the whole day tomorrow. Please ask other families as well.
Thank you so much
Dr.
for listening as well.
very much for assisting us with this session. Yes. Ashraf.
Okay. Thank you guys so much for your presentation. I felt that there was a theme between, I'm talking to the parents now, Adriana. I felt there was a theme between the two presentations. We heard about what I feel like a delayed diagnosis, uncertainty about diagnosis, first time to hear about Kawasaki. So since we have 189 people on the call, or now 190 and climbing, what's your advice to us today when we see new patients? What's your message to the people who are taking care of new patients who presents today with a fever? What things should we be talking to the parents
about? If you're asking me, I think
in a few words.
In a few words, okay. You should doctors should not be shouldn't have high egos and ask other doctors about their concerns. With Adriana's case, we learned always to ask 3 doctors. In Lebanon, we have the French and the American system. So we used to take files to a French educated doctor, to an American one, and a third party, just to take 2 out of 3 opinions. That's what we learned. And it's always good to ask, because like our doctor, he did not take his decision alone. He asked other doctors, but still he insisted on that, thankfully. And he was in contact with Dr. Linda Dow, and that's how we got the diagnosis for Adriana.
And I would like to add something to Carla's opinion. Just don't dismiss us. Moms know a lot. We are living with them. We know when they had the temperature. We know when they're not well. We know when they're not sleeping. It took for us 6 doctors and a surgeon to admit my son to hospital. So it was really absurd, to be honest with you. Yeah. So if it wasn't for my consistent, God knows what would have happened.
Thank you. I hope that one day we will do a medical publication based on patients and families' suggestions. It's a treasure. If it's not written in medical literature, it will not get across easily, but we will do that. It's a promise. Thank you.
True,
So we have
true.
to move on to the next session. Take care, everyone.